Hi, Ann Sylvester here. Let's talk a bit about surgical procedures that maybe are appropriate for general practitioners to do rather than sending everything to specialists. I think that there's a bunch of surgical procedures out there that do warrant a general practitioner who has an interest clearly in surgery taking the time and learning how to do them. So let's say you take an FHO course or an extra cap, maybe a luxating patella course, some, I'm going to say, more common orthopedic issue that you're likely to see on, a pretty consistent basis. So because you see a certain amount of these cases, you're more likely to get good at doing the surgery. So, it doesn't make sense to say, "Oh, I'm going to learn how to do total hips," because the number of times you're going to do a total hip is small. You'll never get good at it, especially in a general practice. At least these cases are augmented, accentuated in a referral setting. So you take an FHO course, you take an extracapsular repair course. That doesn't mean you should be repairing all the potential FHOs that come your way or all the cruciate tears that come your way. Pick the cases that carry a good prognosis and do well. Get good at it. Send what I'm going to call the loser cases to the board certified surgeon. Let them deal with it. I mean, that's what we're trained to do. If you start doing cases and you end up with good success rates, you're going to keep on doing it. And as you do more of that surgery, your repertoire of potential case selection will increase. And so you're going to take on more difficult and more complex cases and then leave the real difficult ones and the clients that are just going to come and bite you when the whole procedure's done because they're going to be unhappy no matter what. My God, send those ones off. Why would you deal with those, right? Keep the cases that are going to allow you to sleep at night, allow you to make some money, right? Not take all of your resources, all of your time, all of your receptionist time and technicians' time because the clients are demanding or the case is not going well. You'll never make your money back, get your time back, and get your confidence in any, state that's going to be useful to you by dealing with those cases. So it's not about, I now have learned how to fix a fracture, I'm going to fix them all. No, I know now how to plate a bone, maybe, or pin a broken bone. Pick and choose the ones that are going to do well. Case selection should be something that you learn when you take a course. If it's not an actual particular topic, ask the questions. Which cases should I be starting with, and get the answers to that. All right. Together, I know we can help a lot more patients. You guys should do the ones that are going to carry a great prognosis and send all the other ones off to the boarded surgeons.